Okay, this video is what are atherosclerosis risk factors? And it's worth knowing because this is the most likely reason you're going to die. Atherosclerosis is the most common reason people die. And it's a systemic process. It's not just heart disease. It's not just heart attack, myocardial infarction. It also causes congestive heart failure, atrial fibrillation, plugs up the artery supplying the hearing apparatus, causes deafness, causes blindness, causes stroke, causes impotence, causes all kinds of things in the body to become dysfunctional. It's the most common cause of back pain. And here's the good news. It's easy to prevent. Okay, you know, Esselstyn has prevented it and reversed it. All right, let's just go through the risk factors real quick here. Here's lifestyle. Okay, some things you can't change, you know, when you get older. Men have much higher risk before 50 years of age because the woman's menstruating, which is a therapeutic phlebotomy to lower her hematocrit, for example, number of red blood cells in the blood. When women become postmenopausal, their risk goes way up. Smoking tobacco, totally stupid. Inhibits nitric oxide production, raises hematocrit, activates platelet, all bad. That's another reason why it increases cancer risk, because it activates platelets. They can hide metastatic cancer cells. Okay, alcohol is real atherogenic, and what's his name? That Lustig guy is funny. He says dietary fructose, high fructose corn syrup is like alcohol without the buzz. They both get made into 2 carbon units in the liver, like acetyl-CoA that gets made into fat. They both increase fatty liver. Being sedentary, well, you can easily exercise. You could not drink. You could not smoke. Try not to be too stressed out. Some of it we can't control, but getting our sleep and avoiding unnecessary nonsense markedly reduces our stress levels. Avoiding caffeine, avoiding corticosteroid medications if possible. Go to bed earlier. I noticed one thing that lets me sleep better is when I didn't have a computer for a week. I had nothing to do. I went to sleep earlier. Inflammation's not that big a part of atherosclerosis. If it was, how come cortisol makes it worse? It's a very powerful anti-inflammatory medication. How come? All right. Anyways, air pollution, diesel exhaust fumes, prothrombotic. Air pollution contributes. Poverty, lack of education. Well, educate yourself. Read a book. Listen to educational videos. Lack of sunshine because you lose the nitric oxide precursors, for example. Lack of religion. Religious people are healthier, any of the major religions. Having a sense of purpose in life, it gives you direction, makes you resilient. And then, of course, diet is the most important thing, and it's the easiest to control. High-fat diet is atherogenic. Lack of greens means lack of nitric oxide precursors. High monosodium glutamate, manufactured free glutamate diet. It's how you create obesity in experimental animals. Makes people fat. Processed food makes people fat, plus all the other bad stuff in there, including all the mitochondrial inhibitors from the mold inhibitors, from the atrazine, etc. High fructose corn syrup is bad. Meat is bad. Increases TMAO. High sodium is bad. Blocks nitric oxide production, etc. Lack of dietary, all the good stuff's in plants. So if you don't eat plants, you lack potassium, magnesium, nitrates, antioxidants. And I think that's why black people in America have so much hypertension. But everybody tells them genetic. That's BS. And, in Kenya, where they eat plant-based diet, they don't have a problem with hypertension. High estrogenic chemicals, there's a lot of them in the meat to make the animal fat. Unfiltered water is real high in estrogenic, so filter your water. Don't eat meat. Birth control pills, be careful about being on those too long. Let's see what else. Dehydration contributes. The blood becomes a little more dried out. Prothrombotic. Medical conditions associated with increased risk of atherosclerosis include chronic kidney disease. They got multiple reasons why they become more prothrombotic. There's elevation of blood clotting factors 7 and 8. There's also increased fibrinogen in the blood, which is prothrombotic. Increased platelet activation, again, a risk factor for metastatic cancer spread, but it's also for clotting. Hypertension, high blood pressure, F- toothpaste and mouthwash. We've talked about that before in my lectures on nitric oxide because they prevent conversion of the nitrates from plants into nitrites in the mouth. So NO3 nitrates to NO2 in the mouth, nitrites go to the stomach, get converted to NO. But if you block that part of the pathway, because it'll kill the bacteria on the back of the tongue that are needed for the conversion from NO3 to NO2, from nitrates to nitrites in your mouth. Obesity, diabetes, fatty liver, all from high-fat diets, sleep apnea. These things are all tend to be highly related. There are atherosclerosis risk factors. Most diabetic patients die of myocardial infarction, heart attack. Infections are prothrombotic. The acute antibodies like the IgMs can overcome the zeta potential of the red blood cells, stick them together and cause clotting. Atherosclerosis is a blood clot. So anything that causes clotting is going to increase atherosclerosis risk. Sickle cell anemia is prothrombotic, and that's why a young person can have a myocardial infarction at a young age. Not because they have high cholesterol, it's because they got prothrombotic sickle cell anemia. Lupus can do it, very prothrombotic condition. Calcium supplements, when excessive, over 1,400 milligrams a day, have a big increase in myocardial infarction risk. Leaky gut or leaky gums, because then you get bacterial endotoxins into the blood. Postprandial endotoxemia, it's called, putting you at increased risk for amyloid clotting because they're very prothrombotic. If you got high blood lipids, hyperlipidemia, increased total cholesterol or LDL cholesterol, increased triglycerides will all do it, lipoprotein little a, increased C-reactive protein in the blood is just a marker of somebody, for example, who's got inflammation or who's eating a high-fat diet. Abnormal increase in hematocrit, like those Tour de France bicycle riders who took EPO-EAT to raise their hematocrit, but were at increased risk then of myocardial infarction. Increased serum ferritin in the blood. So if you're iron overloaded from eating too much meat or from eating processed food with iron added back to it, reinforced with iron, that's bad. You don't want that. You can get ferrous redox cycling in the blood where it flips back and forth the iron from Fe2 plus to Fe3 plus, and that can cause amyloid clotting as well, similar to the effect of postprandial endotoxemia. And Douglas Kell, Atherese Pretorius have very good lectures on all this stuff. Lots of things cause leaky gut. We've talked about that before. I had entire lectures on that, like with 25, 30 things that cause leaky gut, leaky gums, poor dentition. I just listed these things because they're associated with leaky gut and leaky gums, because they can have, emulsifiers, oils, all these weird chemicals, carrageenan and all that stuff. Increased uric acid in the blood from eating meat or from eating high fructose corn syrup. Migraine headaches are associated with increased risk. Stimulants like cocaine, amphetamines, positive family history, which I think is largely because of eat the same diet usually, but can be associated with genetic conditions that'll predispose you, like elevated lipoprotein little a and a few other ones, hypercholesterolemia. So anyways, here they are, and almost all of this stuff is able to be controlled, and the most important things you can control. Get your exercise, eat your good diet, get your sunshine, have a religion and a sense of purpose in your life, and if you need to, lower your serum ferritin, and don't be too dehydrated, and you can dramatically lower these risks. Esselstyn said that every single patient who followed his advice never had a recurrent cardiovascular event. So hope that was helpful.